వరల్డ్ హెపటైటిస్ డే అన్నారు కానీ హెపటైటిస్ అంటే మనకి మీనింగ్ తెలుసుకోవాలి ఫస్ట్. అంటే ఇట్స్ ఎ డ్యామేజ్ ఇన్ ద లివర్. సో లివర్ డ్యామేజ్ ని హెపటైటిస్ అంటాం. హెపటైటిస్ అనేది చాలా కారణాల వల్ల వస్తుంది మనకి. మోస్ట్ కామన్లీ ఆల్కహాల్. సో మనకేంటంటే ఇప్పుడు ఈ ఇయర్ వచ్చేసరికి వరల్డ్ హెపటైటిస్ డే వైరల్ హెపటైటిస్ గురించి మెయిన్ గా మాట్లాడుకోవాలి. ఎందుకంటే వైరల్ హెపటైటిస్ అనేది కొంచెం న్యూసెన్స్ గా తయారైంది జనాలకి అందరికి. సో I think the audience is Telugu or English? You can speak in English or Telugu, right? Okay. This year the program is mainly revolving around viral hepatitis. So viral hepatitis means nothing but a virus which can affect the liver. Just like alcoholic hepatitis, which the alcohol affects the liver, this is viral hepatitis. Coming to viruses that can affect liver, there are so many viruses which can affect liver. So we broadly classify them into hepatitis viruses and non-hepatitis viruses. Hepatotropic and non-hepatotropic. Okay, then coming to hepatitis, we have A, B, C, D, E viruses, common viruses. Of these, B and C viruses are mostly studied because of their impact on the global community and on the healthcare systems. So coming to B and C, these are spread mainly by the parenteral routes, which is meant by bodily fluid or to say mother to children transmission, like those things. And coming to A, D and E, these three viruses are spread mainly by orophycal routes. Then coming to viruses B and C, coming to viruses B and C, viral hepatitis B, if you get this virus, it won't leave your body. So we should be careful. And all the remaining viruses can leave the body except B, because this B virus can form certain links with our DNA and stay in the hepatocyte throughout the life. And our immunity will keep that virus in check. Otherwise, we will be getting so many cases. So coming to the impact of these viruses on the society, we should know that for every 30 seconds, there is a life lost due to this viral hepatitis. So you can imagine the problem. Every 30 seconds, one life is lost. Roughly around 12 lakh people per day, 12 lakh people per year die due to this viral hepatitis. So you can imagine the problem. So what we should do? This year's main theme is we can't wait. Why? Why we can't wait? Because the burden is such. The viruses need to be eliminated. These need to be what to say? Because the impact is so high on the healthcare system, we should be very careful regarding these viruses. Then coming to when should we start to worry about these viruses? When the baby is in the mother's womb itself, we should worry, because in pregnancy, all the pregnant ladies should be screened for these viruses. And if they are found positive, then they should be treated accordingly. Otherwise, the chance of the virus getting into the baby is very high. Then after the baby is born, if the mother is not a carrier for this virus and the baby is born, that baby needs to be vaccinated. So we have a vaccine for hepatitis B virus and A virus. So if we give these vaccines, the baby is safe from these two viruses. If the baby is unable to get B virus, then in life he won't be able to get D virus also. There is no vaccine for C virus and E virus. Usually the E virus affects the pregnant women. Most commonly, the pregnant women are affected by the E virus. So they should be taught before the pregnancy itself. The women should be taught about these viruses and how to take care of themselves in the pregnancy periods. After the baby is born, like I said, there is a vaccination program in India. Now every baby that is born is being given the hepatitis B vaccine. The course is three dose course. One is given at the 0 month, second one at the 1 month, and third one at the 6th month. So this is, then we should start screening for the population uh, after they are, if they are not vaccinated in the childhood, they should be screened, because screening, if we find any positive cases, immediately we can take care of the surrounding areas also. Surrounding areas in the sense, if one person in the family is affected with this virus, we should screen the entire family. We cannot wait to wait for the people to get around him the virus. So that's why we should wait. We can't wait. Sorry. So if we found a person who is hepatitis positive, then we can see whether the virus is in check or is it is causing any damage. If there is any damage, there is treatment. Okay. Then if the persons around him who are not having this virus, then we can give them vaccine. At that time itself, they are very safe. Then coming to uh, why we are so much worried about these viruses is because of the health burden. So if we see the health burden by these viruses, if these viruses are not controlled, then the patient's liver might get damaged. If there is such damage, then the patient might need a new liver. If the liver transplantation cost, everyone, it is very high. And there is a lifelong treatment for the immune suppression if after the transplants. So that is there. So it's all adds up to the healthcare burden because of these viruses. Even the hepatitis C virus. What happens if these viruses are not treated? If these are not treated, some patients might develop cancers from the liver. These are called hepatocellular carcinomas, and these viruses are known for them. Uh, the hepatitis B, like I said, it gets into the patient's DNA and it will change certain genes so that the patient develops cancer. That's it. So we should avoid such stages to be happening. So we have to remove these viruses from the face of the earth, which I think is very time taking, and that's why this year program is, we cannot wait. Why we cannot wait? We cannot wait to get tested. We cannot wait to get treated. We cannot wait to get educated. One more thing, there is a discrimination regarding these viruses. Like we saw in COVID, if person is COVID, we used to avoid them. So similarly, even for HIV, it's a virus. We used to avoid them. Not, I mean, we as a population, general population, we have negative stigmata. That's what I meant to say. That negative stigmata about these viruses should be gone. So if you are vaccinated for hepatitis B virus, you are safe. If a person gets hepatitis C, again we have a cure for hepatitis C. We don't have cure for hepatitis B because the virus can be sent away from the body. But for the hepatitis C, we have cure. We can remove the body. We can remove the virus entirely from the body. So that is there. And hepatitis A, it's self-limiting, very small, 1 week or 10 days disease. It will go on its own. And one more virus we should worry about is hepatitis E. And this is very dangerous virus, especially for pregnant women. And this virus is fatal in them. So it can cause permanent liver failure in pregnancy. Can imagine the health. Huh? So regarding the treatment, again, like I said, prevention is better than cure. Okay. Um, so B virus, we can prevent it entirely by taking a vaccine. C virus, we have a cure. We cannot prevent it because there is no vaccine for it. We can cure it. Again, A, it is self-limiting, it can go away. And D virus, you should worry about D virus if you have B virus. Otherwise, nothing to worry about that. And hepatitis E virus is, like I said, it is spread mainly by orophycal route, which is mainly contaminated drinks, contaminated water, contaminated food, all these things. So proper washing and proper cleaning the utensils in the kitchen, everything, even the vegetables you bought from the market, it should be cleaned. And such ways you can prevent the hepatitis E. So again, the treatment is very simple, and you can visit your general physician or a gastroenterologist or a hepatologist for further clarification regarding these doubts. Okay, I hope this message might help some.